from Vision by Design. So we are a local optometry clinic that also provides vision therapy in Edmonton. This is one of my staff members, Jenny, and we are here to talk to you about a topic that really affects Albertans regularly, and that is dry eye. So the Alberta Optometry Association actually recently conducted a survey, and they found that 90% of adults are actually experiencing symptoms of dry eye, and this really doesn't surprise me because I see this in the clinic all the time. This is a topic that I talk about constantly with patients. I think every one of my eye exams has some sort of dry eye consultation in it. So it's something that's definitely significantly affecting Albertans.
What is dry eye?
That's a good question. So dry eye is a syndrome where the patients are either not producing enough tears or they're not producing a good quality of tears to actually lubricate the front surface of the eyes. So this can occur when there's poor tear quality, where your tears actually evaporate too quickly, or again, you're not producing a large enough volume, or they're draining out too quickly. Tears are a really important component to vision, so they actually provide nutrients to the front surface of the eyes. They of course lubricate the front surface of the eyes, they flush away bacteria and debris from the eyes, and they provide a nice smooth surface for light to pass through. So when you don't have effective tears, it actually can cause significant symptoms.
What are some symptoms of dry eye syndrome?
Symptoms can vary from one patient to the other. Fluctuating vision is a common one that patients they're not always aware of. So oftentimes I have patients who come in who are complaining that their vision has changed and they're here to get a new pair of glasses, and once we check their prescription, it actually hasn't changed. So the reason why your vision fluctuates is when your tears are evaporating too quickly. You'll blink and you'll have this nice smooth layer where you can see clearly, but then as your tears quickly start to evaporate, you end up getting this dry, patchy surface that starts to disrupt light as it passes through the eye, and it actually causes your vision to blur. So patients are often surprised about this, but if you have vision that is clear for a moment and then blurry for a moment and then it clears when you blink, that's actually a sign of dry eye, whether or not you have symptoms. Then of course there's the more well-known symptoms like burning, itchy eyes, red eyes. You can have like a foreign body sensation where it feels like there's sandpaper kind of scratching the surface of the eyes. And one symptom again that patients are often really surprised about is excessive tearing is actually another symptom of dry eye. So when your tears are evaporating too quickly, it causes your body to produce this reflex type tear, but it's not a lubricating tear, it's just kind of like a runny tear, so they end up just kind of running down your face. So it sounds kind of strange when I'm prescribing eye drops when your eyes are really watery, but excessive tearing again is actually a symptom of dryness.
What are some causes of dry eye syndrome?
There can be lots of different causes. So sometimes it's hard for us to pinpoint what the exact cause is. So environmental factors can certainly have an impact. So we live in a very dry climate, so patients are often more bothered by dry eye symptoms here than if they go on vacation to a more humid climate, for instance. Certain environmental factors as well. If patients are around smoke or fume on a regular basis, those irritants cause significant dry eye symptoms. If you do things like excessive computer use, patients will often have significant symptoms of dryness. Age is also a factor as well, so you can sometimes have issues with tear production that get worse as you get older. And then certain medical conditions like Sjogren's disease, rheumatoid arthritis or other inflammatory conditions, thyroid disease, things like that, they can be associated with dry eye as well. So then controlling these conditions is very important in properly controlling dryness. And then a number of medications are also associated with dry eye.
What are other factors that contribute to dry eye syndrome?
Really anything that causes chronic inflammation to the surface of the eyes can contribute to dryness. So, and this can be anything. I mean, we see patients all the time with varying causes of dry eye. It can be anything from eyelash extensions, for instance, if you wear them all the time and you kind of have this chronic underlying inflammation to the eyes from the extensions, you can develop dry eye over time. Patients who have tattooed eyeliner, for instance, sometimes the tattooing process, it can actually damage the meibomian glands, which produce the oil layer of the tears. So if you have damage to these glands, again, you end up getting dry symptoms. As we talked about, exposure to smoke. So patients who smoke, they're constantly around this irritant that causes significant dry eye. Lots of computer use. We'll talk in another video about computer vision syndrome, and dryness is very commonly associated with computer vision syndrome. So there's a lot of different additional causes that can lead to dry eye symptoms.
Are there any specific tests you can perform to diagnose dry eye syndrome?
Absolutely. So a history is a big one that we start with for dry eye. The other thing we can do is we can actually test the osmolarity of the tears. So if that's abnormal, then certainly we know that there's issues with dryness. We can measure your tear production or your tear evaporation rate, and this gives us lots of helpful information as to what the underlying cause of dry eye is. There's different stains and dyes that we can use to actually look at the tear surface underneath the microscope, and it actually allows us to look at the cells of the cornea as well. There's special imaging that's available where we can actually take pictures of the meibomian glands. Those are the glands underneath the surface of the lid that produce the oil for the tears. So in patients with chronic dry eye, if it's really severe, we can actually see atrophy of those glands where the glands are actually damaged or dying. Or we can see hypertrophy, which is like swelling of the glands when the oil is not being secreted out properly. And patients who have issues with their meibomian glands certainly have a greater incidence of dryness. So there's a lot of diagnostic tests that we can actually do to see if there are signs of dry eye.
How do you treat dry eye syndrome?
A number of treatment options are actually available. So the first thing I always like to talk about is things that we can change in the patient's environment. So things like reducing the irritants, like we talked about, like maybe stopping eyelash extensions or reducing exposure to computer time or taking more breaks, or trying to reduce exposure to smoke or other fumes in the air. Those can sometimes be really important for patients, because if we don't discuss those factors, if they're not controlled, we can do tons of dry eye treatment and we don't really see a ton of improvement if they still have these significant environmental factors. Other things I like to talk about are eye lubricants with patients. So this is something that can be very confusing to patients. When you go to the drugstore, you'll see shelves and shelves of eye drops, and not all eye drops are created equal. Some are much better, and some are have better lubricating properties, or some even have anti-inflammatory properties. There's non-preserved and preserved ones. So depending on the severity or the type of dryness, I always like to recommend a specific artificial teardrop for patients to take. Supplements can also be really helpful. So we talk a little bit about things like omega-3s and ways that you can add that in through your diet. That can have a really dramatic effect on the comfort from dryness as well. Other treatments that we can talk about are things like warm compresses, where you apply heat to the surface of the eyes. The heat tends to open up those glands and allow the flow of oil to be a little bit more effective, so that your body actually starts producing a better quality of tears. And then there's a number of prescription drops available as well, that after patients take them, their body actually starts to produce a better quality of tears, and then other ones that just help to lower the levels of inflammation. So there's all kinds of things that we can do for dryness. What's necessary is really kind of dependent on the patient and what type of dryness they have, but there's so much more you can do above and beyond just taking artificial teardrops.
What are some ways I can prevent dry eye syndrome?
The biggest thing, as I said, is just avoid a lot of the environmental factors. So reducing screen time is a huge one for patients. So we constantly talk about taking breaks on the computer, or using eye lubricants if you're doing long hours on the computer. As we talked about, avoid those things that cause chronic inflammation to the surface of the eye. So make sure you're always removing your eye makeup, and avoiding adding things to the surface of the eyes that actually cause long-term inflammation. Other things that we need to do, we talk about using humidifiers and stuff like that with patients. So again, we live in a very dry climate, so if you can do things like add a humidifier to your bedroom, oftentimes that can be extremely helpful. And then there's dietary factors, as I mentioned, so increasing certain types of foods that contain a lot of omega-3s can be really beneficial for dryness. Increasing your water intake, because of course if you're dehydrated, you have a greater tendency of having more significant dryness as well. So there's lots of ways that we can prevent dryness.
Can dry eye syndrome be cured?
I don't ever tell patients that we're going to cure it. Dryness is a chronic condition. It's often from chronic inflammation. So it's usually a long-term treatment approach. Usually what I typically do is we try to manage the symptoms and lower the level of inflammation. But if we completely completely stop the dry eye treatment, oftentimes the symptoms will come back because it is a chronic condition. So my goal for treatment is to provide treatments where the body can actually start to produce a better quality of tears, where you don't have to rely so much on things like artificial teardrops. And then as your symptoms start to improve, you can typically taper back the treatment so that you don't have to do it as regularly. But I do often find that if patients completely stop the dry eye treatment, their symptoms will unfortunately come back.
Okay. And how can people schedule an appointment to see you, Sarah?
The great thing with dry eye is if it's a medical condition, the assessment can actually sometimes be covered by Alberta Healthcare. We also do the assessments complimentary as part of a comprehensive eye exam. So the best way to book an appointment for a routine eye exam is to either just give our office a call. The phone number is 780-444-6407. You can also hop over to our website at www.visionbydesignoptometry.com and actually schedule an appointment yourself. If you just need a quick dry eye evaluation, that does just have to be booked through our office, so feel free to give our office a call.
Oh, great. Thank you.
Yeah, you're welcome. So hopefully that gave you a little bit more information and can lead to a path of healthy eyes. If you do feel like you're suffering from dry eye, feel free to pop into the clinic and we can take a better look to make some recommendations. Again, I'm Dr. Sarah Keep from Vision by Design Optometry. This is Jenny. Thanks again for joining us today. If you like that information, feel free to subscribe to our video, and otherwise we'll see you next time.